Again, the issue is the arthritis in your big toe joint. So when you have a decrease in the range of motion of your big toe, it means the pressure from walking is going to move somewhere else. And in your case, it's the side of your big toe and here on the bottom. So the callus gets real thick. And with the diabetes and the neuropathy, the skin breaks down. All right, let's see what we have underneath, if anything.
And even if I didn't moisturize it, I mean, it seems like it's like because the, I don't know, it's just
yeah.
The skin.
You see how thick that is? That's just the outer layer. Yeah. Well, we'll see in a second what lurks beneath here, if anything. So far, so good. Let's see. We got a little bit of red spot right here, which means ruptured blood vessels, ruptured capillaries in the skin. And that's typically, if there's going to be an ulcer, where we'll find it. Let's see here now.
So that means I got to start wearing the bandage back.
Well, it looks like it's just those ruptured blood vessels. It doesn't look like a full ulcer here today. This is what we would call a grade 1. We grade ulcers from 0 to 4. 4 being the worst, all the way down the bone, right? 0 being basically a spot. So this is like between like a 0 and a 1. All right, which means we'll be able to deal with it just by keeping pressure off of it. You're not going to need the gauze and all that stuff. Okay. But, because you're getting ready to take a trip in less than a couple of months, you got to make sure that you pad it, keep it protected, and get you ready for your trip. So you don't either have to stay on the boat the whole time you're on the cruise or miss the trip altogether.
Right. That's exactly what my arms were.
Mm-hmm. You like we do, you gotta make sure you get travel insurance, man.
Well, I'm sure I got it.
Yeah, so I feel good about what we see here today. The skin hasn't broken down, there's no ulcer, there's no wound. But that red spot, we got to keep an eye on. So I do want to see you next week anyway, just to make sure everything stays, or actually improves. Now that we've shaved the callus down, remove the high pressure area, that red spot should go away within a few days.
All right.
All right. Yeah, it's like grade 0, grade 1, grade 0.5. Right, no, not at all. But that doesn't mean we can just wash our hands with the whole thing. We still got to keep it tight reins on it. I want to put some moleskin on it today. Yeah. You still have some moleskin?
No, I don't think so.
Okay, I get you started, and then they have it at the drugstores.
I can probably do one. Should be able to get with my OTC card. It's a medical expense.
Yeah. And the big toe is fine as well. Just remember now to be sure you're wearing shoes and accommodate like you have today are fine.
Yeah. That's basically that, and the shoes that you ordered me is basically all I've been on.
Yeah. So you don't want to wear anything too formal. You know how like on cruises, you know, there's, you know, it's for dinner.
Yeah.
Yes, there's a dress code. Yeah, as far as the shoes are concerned, bump the dress code. You just wear what's comfortable for you,
Right.
and it's going to keep your feet protected.
Because ain't nobody really looking down like that anyway.
There we go.
As long as the top area is just.
All right, I'm happy with that, brother.
All right.
Dodge the bullet, man.
All right.
Again, you can go to the CVS down the street and get this if you need it today, or otherwise, you know, I know it's on like your Amazons and all that kind of good stuff. But what this does is going to help decrease the pressure and the friction here. Not as much like a full insole, which you also need. It's already with the shoes and everything. But this is additional. Right, in a situation like this, you take everything you can get.
Right.
You just be sure you put it on after your feet are nice and dry.
Yeah.
Okay, before you grease them up and all that other kind of good stuff. So it'll stick. And we'll go about the way. Now, I'll see you back next week just to make sure everything's cool. Not like, again, if there's any problems between now and then, redness, drainage, swelling, fever, okay, or pain, you get at me right away. Don't wait till next week. Okay? All right, boss. I'll see you in a minute. Let me get you out of this chair. This is Kevin Jefferson, the DC Foot Doctor. Thank you for watching this video. Like it with a big thumbs up and subscribe to the channel. Share it with your family and friends and ring the bell so you will know when a new video has been uploaded. If you have any of the issues in this video or any of my other videos, see a podiatrist as soon as possible. But most importantly, take care of your feet.